Bismillahirrahmanirrahim and Assalamu alaikum. Welcome to the Health Maestro. Viewers, in this video we'll talk about the association of body type with health risk. Fat storage in body strongly affects your body type. So there are two common body types that result from fat storage. First is android, apple shaped. Second one is gynoid or pear shaped. Men tend to carry more of their body fat in and around the abdominal area. This type of fat deposition is called the android or apple shape. The body type most common among females is the gynoid or pear shape. This body type is characterized by fat storage in the hip and thigh region. Women generally have a higher percentage of body fat as compared to men. A person's body type is recognized as an important predictor of risk for hypertension, that is high BP, hyperlipidemia, that is high cholesterol, coronary heart disease, type 2 diabetes, and premature death. So individuals with more body fat in the abdominal area, which are usually males, are at increased risk of developing the above mentioned conditions as compared to the individuals who are equally fat but have most of their fat in the hip and thigh region, that is usually women. So how to determine the body type and health risk? There are two common ways to determine. First is waist to hip ratio, second is waist circumference. To determine waist to hip ratio, use a measuring tape to measure the smallest part of the waist, that is usually above the belly button and below the rib cage, and then measure the largest part of the hip. Make sure the measuring tape is horizontal all the way around the body when taking a measurement. While measuring the hip circumference, make sure you are standing with your feet together. Now, the waist to hip ratio is the circumference of waist divided by the circumference of the hip. The measurement can be taken in inches and in centimeters too. For instance, if your waist circumference is 32 inches and your hip circumference is 44 inches, by using the formula, divide the waist circumference with the hip circumference. That is, divide 32 inches by 44 inches and you'll get a waist to hip ratio of 0.72 inches. So ratios above 0.95 for young men and 0.86 for young women place the individual at very high risk of diseases. For the age group between 60 to 69 years, if the waist to hip ratio for men is above 1.03 and for women is above 0.90, it means that they are at very high risk too. The second way is to measure your waist circumference. Recently, waist circumference alone showed the relationship of obesity and the health risk. A healthy waist circumference for all ages is below 102 cm, that is 40 inches for men, and 88 cm, that is 34 inches for women. I hope these methods will help you determine your body type well, and in case your waist circumference or waist to hip ratio exceeds the suggested limits, then look for ways and dietary changes to cut down the fat from your body. Lastly, do not forget to subscribe my channel. Take care and Allah Hafiz.